Hello, my name is Megan Black, and I'm an adult gerontology nurse practitioner student with Maryville University. Today I'm going to complete a head-to-toe assessment for my advanced health assessment course. This is DV. He's volunteered and consented to be my patient today for this assignment. Before we began, I had him change into a hospital gown, had him empty his bladder. We obtained a height and weight and full set of vital signs. His height was 6'3", weight was 215.2 pounds, heart rate was 85, temperature 97 degrees, blood pressure 128/90, respiration 16, and he had an O2 sat of 97% on room air. I also checked his nearsighted vision using the Rosenbaum chart, and then his farsighted vision using the Snellen chart. I washed my hands and we're ready to begin. I will first begin with inspection of the head and face. I'm looking at his skin, checking for any lesions or abnormalities, paying careful attention to any moles. I'm checking the symmetry of his eyes, ears, and mouth, and looking at his skull to ensure that it is normocephalic. Okay, so everything looks good there. Now I'll check the cranial nerves. So I'm just looking to make sure that everything is even and symmetrical. Can you clench your teeth for me? Okay. Can you squeeze your eyes tightly shut? Okay, good. Can you wrinkle your forehead? Smile. Stick out your tongue. Move it from side to side. Very good. Okay. Can you puff out your cheeks? Good. Let's see. I'm going to test your sense of smell. So I'm going to give you two things to smell, and I just want you to tell me what you think they are. So if you will, close your eyes for me. Did you smell anything?
Yes.
What do you think it is?
I have no idea.
Lavender.
Lavender, okay.
But you did smell it when it got
Yes.
close? Okay. This next one you should be able to tell. Okay.
Peppermint?
Yes, great. Okay. And then I'm also going to test your sense of taste. So what we're going to do, I just want you to dab a little bit on your finger with your tongue. Use the first one. I want you to put that on your tongue and tell me if it's sweet or salty.
Sweet.
Okay, and then let's try this one.
Salty.
Okay. I think that really gets most of our cranial nerves. We'll do a few more as we continue with our assessment. Next, I'm going to palpate his scalp to make sure that there are no masses and that it's freely movable, and then also to make sure that the hair is evenly distributed. I'm also going to check his facial bones, looking for any masses or areas of tenderness. His TMJ, so I'm going to go ahead and do that. I'm just going to feel on your head here. Everything looks good there. Okay. Can you open and close your mouth? Okay. Notice that there was a little popping there. Okay. And then I'm going to palpate the sinuses. Very good. Any tenderness?
No.
Okay. So the last part was just checking the temporal and maxillary sinuses for any tenderness. Now I'm going to test light sensation on the forehead, the cheeks, and the chin. Okay, so what I'd like you to do for me is I'm going to have you close your eyes, and then I want you to tell me if you feel this evenly on both sides, okay?
Yes. Yes. Yes.
Okay, great. So sensations are good. I'm going to inspect his eyes, examining his eyelashes, looking for the hair distribution, making sure that they are poking up and outward, and they are. His eyelids, his eyebrows, making sure that the hair is evenly distributed. I'm also going to look at his sclera, which is a normal white with no yellowing. And then I'm going to check his conjunctiva, and I'm just looking for any redness, swelling, or drainage, and everything looks good there. I'm going to palpate the lacrimal apparatus by lightly feeling with the pad of my index finger against the upper orbital rim. Any tenderness?
No.
Okay. All right. And also I want to palpate the nasal lacrimal duct to check for any obstruction by pressing with my index finger on the lower orbital rim at the lacrimal sac. Any tenderness?
No.
Okay. All right, and then I want to check its pupillary response with my pen light. So I'm just going to have you look across there for me. And I'm just going to make sure that the pupils are reacted to light, that they're equal, they're round, and that there is a direct and consensual response. Direct, consensual, direct, and consensual. Okay, so next is the cover-uncover test. I'm going to ask you to cover your right eye and just look straight ahead. Good, and I'm looking for any involuntary movements or nystagmus if you look straight ahead. Okay, and then let's do the other eye. Great, okay. And I'm going to inspect the red reflex with the ophthalmoscope. Okay, so that looks good. I'm also going to assess fields of peripheral vision. So, what I want you to do is, I want you to cover one eye at a time, and then I want you to tell me whenever you see my fingers move, okay? So cover your right for me.
No.
Okay, and the other side.
No.
Okay, great. And then we also want to check the extraocular eye movements. So I'm going to do that by checking the 6 cardinal fields of gaze with my pen light. So what I'm going to do is I'm going to ask you to keep your head still, and I just want you to follow this with your eyes only, okay? Okay, so we'll start here. Okay, and that completes that part. So when I was doing that, I was just looking for any further signs of involuntary movements or nystagmus. So now I'm going to inspect his ears. I'm looking at alignment and symmetry, and I'm going to palpate the auricles just to make sure that they're smooth, pliable, and that they're free of nodules. So everything looks good and even. Any tenderness?
No.
Okay, and I'm also looking at the skin of the ears, just to make sure that there's no lesions. This is a place that skin cancers commonly found. And then we're going to check his hearing with a whisper test. So what I'm going to do is I'm going to walk behind you, and I'm going to ask you to cover one ear at a time. And I'm going to whisper a word, and I want you to tell me what that word is. Okay? Okay, so let's cover the right ear.
Orange.
Okay, and then the left ear.
Apple.
Okay, great. Okay. Now I'm going to use my tuning fork, and we're going to do the Weber test. So I'm going to strike the fork, and I'm going to set it on top of your head, and I want you to tell me when you stop hearing it, okay?
I don't hear it. Okay.
Okay. And now we're going to do the Renee test, and I'm going to strike the fork. I'm going to set it on the bone behind your ear. I want you to tell me when you stop hearing it, and then I'll move it in front of your ear, and I want you to tell me when you stop hearing it. Okay? We're going to do this to both sides. Okay?
Okay. Okay.
Okay, so we'll do the other side.
Okay. Okay.
Okay, great. So that was good results. The air conduction was at least 2 times greater than the bone conduction. Okay, so now I'm going to use my otoscope to check the ear canal and the tympanic membranes to make sure that there are no lesions, perforations, blockages, or signs of infection. And I'm just going to make sure that I pull the ear up and back as I enter with the otoscope. Any discomfort?
No.
Okay, I see a good cone of light. Tympanic membrane is gray and pearly. Good, just a little bit of wax. Okay, and then I'm going to move on to the other side. Okay, everything looks good there. Okay, so now that we've done that, that finishes assessing the ears. We're going to move on to the nose. So what I'm going to do is I'm going to ask you to tilt your head back, and I'm going to look up into your nose, okay? So I'm just going to look up into his nose, and I'm just checking the nasal turbinates, making sure that they're pink and moist, looking for any lesions or polyps, any drainage. And I'm also checking the structure of the septum to make sure that it's not deviated or anything like that. It does look really good in here. Okay? And then what I want you to do for me is I want you to cover one nostril. I want you to push it in and block it. And I want you to breathe in and out on the other side. And then the other side. Any trouble getting air to move?
On this one.
Got a little bit of drainage in that one. After we finish the nose, we're going to move on to the mouth. And I'm going to start with the lips. And I'm just checking for any lesions or blisters. Checking for any cracks. So let's see your lips here. Okay. And then we're going to open the mouth. And I'm going to inspect the buccal mucosa. Okay, so if you'll open your mouth for me. I'm checking each side. Okay. And then stick out your tongue for me. Say ah.
Ah.
Okay. Lift up your tongue. Okay. And I'm also assessing the teeth for number. Looking at the surface characteristics of the teeth. You can put your tongue back down for me. I want you to tilt your head back a little bit further for me. Open up. Say ah.
Ah.
Okay, I'm checking the soft and hard palate. Okay, stick out your tongue. I'm going to push down a little bit. Say ah.
Ah.
Okay, the uvula, the tonsils. Very good. Okay, so there, I was just checking his tongue, the buccal mucosa. I checked the gums, looking for any bleeding, any recession of the gums, or any indication of infection. Looking at the tongue for any signs of candidiasis, or if there was any dryness or cracks, because that could indicate dehydration. And checking the teeth, noting the color and the surface characteristics. And then I checked the hard and soft palates and the floor of the mouth. And that's when he was lifting up his tongue for me. And then I assessed the oropharynx, the anterior posterior pillars, uvula, tonsils, the posterior pharynx, and I checked mouth odor as I was up close and personal. Okay, so next we want to test the gag reflex and the awe reflex. So we'll start with the awe reflex. I just want you to open your mouth for me, really wide, and then say ah.
Ah.
Okay. And there I was just watching the uvula rise symmetrically with the soft palate. The next thing that we're going to do is we're going to test the gag reflex. It's maybe a little bit uncomfortable, but it will be over very quickly. Okay? I want you to open your mouth for me. Is that not feeling like it's going to gag you? Well, I'll be dang. That doesn't bother you at all? I'm touching the back of your throat. Well, apparently he does not have the gag reflex. Huh. Did not know that. Did not know that. So now that we're done with that, we're going to move on to the neck. So I'm going to inspect the neck for symmetry, for smoothness of the neck, inspecting the thyroid for any enlargement or goiter, and checking for any jugular vein distension. So I just want you to look straight forward. You don't have to tilt your head back or anything. I'm just looking. Everything looks good. Okay. All right. So that's just a visual inspection. And then I also want to do some passive and active range of motion, having you move your head or your neck to the left, and then to the right, then forward and back. And then I want you to shrug your shoulders for me. Okay, so we did that. This time, we're going to put a little bit of resistance to it, okay? So I want you to move your head to the left. Okay, good. To the right, good. Down, good. And back, good. And then shoulder shrug. Very good. Okay. I palpate the carotid pulses, and I'm also going to auscultate those. I'm just going to be checking for any bruise. And then we're also going to palpate the position of the trachea to make sure that it's midline, that it's not deviated. And also we're going to palpate and auscultate the thyroid. And I'm just checking to make sure that there's no, nodules or thyromegaly. So we'll go ahead and do that. We'll start with palpation. So you're going to feel me touch your neck, okay? The trachea is midline. And then we're going to palpate the thyroid. So there's the add-on papilla. Feel he's got very large sternocleidomastoid muscles that kind of get in the way. I don't feel any nodules or any enlargement there. Can you go ahead and swallow for me? Good. Okay. And I saw that the thyroid and the Adam's apple did rise with the swallow, so that's what we would expect to find. So let's go ahead and listen to you. I'm going to listen. All right. I want you to take a deep breath and hold it for me. Very good. And we'll do the other side. I want you to look straight ahead for me. Deep breath and hold. Okay. And you can breathe normal for me. Palpation of the lymph nodes. We're going to do the front and behind the ear, which is the pre and post auricle nodes. And then we're also going to do the occipital behind those, the tonsillar, the submental, the submandibular, the superficial cervical chain, the posterior cervical deep, the deep cervical, the supraclavicular, the infraclavicular, and then we're also going to do the axillary. And I'm just checking to make sure that the nodes are all freely movable, that they're non-tender, and that I don't feel any enlargement of any of the nodes. Okay? Try to get where the camera can kind of see. You don't have to do that. Try this real quick. Go ahead and put your arms out. Okay. Thank you. Okay, and then what you do, just put your arms out to the side like that. There we go. I'm going to feel up underneath your armpits, okay? I'm just feeling for lymph nodes. Any tenderness? Okay, great. And if it's okay with you, we're going to leave this off for a little bit, okay? Now we're going to move on to the upper extremities. So I'm just going to inspect and palpate the hands, the arms, and the shoulders. And I'm just looking at the skin, making sure that there's not any lesions, that there's not any moles that may be suspicious. I'm going to check for cyanosis, check his fingers. I want you to put your arms out in front of you for me. Just checking capillary refill. Make sure it's less than 3 seconds. Looking at his nails for any clubbing, anything like that. Everything looks good. Muscle tone looks good. I don't see anything that I need to be worried about. Put your arms like this, and we're going to go and check your pulses, okay? So I'm going to check both sides. I'm going to check the brachial, and then I'm going to check the radial, just making sure that they're even and that they're regular. Okay, very good. Very good. Okay. I want you to try to pull up. Good. Pull up. Good. Okay. Then go down. Good. Arms up to your side. Go up. Okay. Down. Good. Down. Or up. Okay, and then down. Okay, very good. Very good. And then I want you to just lift your arms up above your head. Okay? And I'm just checking to make sure that the shoulder range of motion is normal, that there's no arm drift. Okay, keep those down for me. Would you give me a little squeeze? And a little squeeze. Good. Okay. That actually kind of hurt. Anyway, so that includes the upper extremities. So next, I'm going to inspect and palpate the back and the posterior chest. I'm looking at the skin, at the thoracic configuration. I'm also going to palpate and percuss the costovertebral angle, which is located between the 12th rib and the spine, to check for any tenderness that could indicate pyelonephritis. So I'm just feeling, making sure that everything feels normal as he breathes normally for me. Okay, any tenderness?
No.
Okay. Would you tell me if you feel any tenderness with this?
No.
Okay. All right. Next is to check his lungs. So I'm going to start with inspecting the respirations. Okay. And I just want you to breathe in and out for me as you normally would. And I'm going to feel your chest expand. Okay. And now I'm going to check for tactile primitives. So what I want you to do is, as you feel my hands move down your back, I want you to say the phrase 99 for me, okay? Okay.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, great. Now I'm going to percuss the posterior chest. So I'm going to start with your back, and then I'm going to ask you to raise your arms above your head, okay, so that I can kind of get to the sides, to the lateral aspect, okay? Okay, and if you'll raise your arms above your head for me. Okay, very good. Okay, you can relax your arms down now. So now I want you to lean slightly forward for me, okay? And just relax right there. And what I'm going to ask you to do is I'm going to ask you to take a deep breath and blow it all out and hold it. And I'm going to measure, okay?
Sure.
So you're going to feel me tapping on you, and then I'm going to make a little mark, okay?
Sure.
All right, I want you to take a deep breath, and I want you to blow it all out. Okay. All right, take a couple of normal breaths. Okay. And then this time, I want you to take a deep breath, and I want you to hold the air in. Okay? All right, whenever you're ready. Okay, great. Good job. Okay. Now we're going to do the other side, okay? Are you all right? Okay. All right, so this time you're going to take a deep breath, blow it all out, and hold. Okay? Whenever you're ready. Okay. And just take a couple of normal breaths. Okay. And then this time we're going to hold the air in, okay? All right. Lean forward for me. And deep breath, hold it in. All right. So that is That's great. I checked diaphragmatic excursion, and what I would want to see is 3 to 5 centimeters, which we have here. Usually the right side can be a little bit higher. In this case, I think it's just slightly higher. If diaphragmatic excursion was less than 3 centimeters, then this could indicate pneumonia or pneumothorax. Now we'll also take the lungs. First the posterior chest, comparing side to side, and then the anterior chest, comparing side to side, and then the lateral chest, comparing side to side. So I'm just listening for any adventitious breath sounds or lung sounds such as wheezes, crackles, or bronchi. All right, I want you to take some deep breaths for me. Deep breath. And out. Just in and out. Okay, and then I'm going to move around to the front, if you will. Turn to the side for me. Very good. All right. We're going to do a deep breath here. And out. You okay? All right. I want you to put your arms up for me. There we go. That'll work. Deep breath. And out. Very good. Now I'll check for bronchophony, egophony, and whispered pectorilicoid. So when you feel my stethoscope on your back, I'd like you to say the words 99, 99, okay? And this is to check for bronchophony. Okay.
99, 99, 99, 99, 99, 99.
Very good. Okay. And then this time, when I put my stethoscope on your back, I want you to say E and kind of hold it like E.
Okay.
Okay.
E, 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 E.
Very good. Okay. And then this time, what I want you to do is I want you to whisper. Okay? Okay, very good. Moving on to the anterior chest, we're going to move on to the heart and the anterior lungs. So what I'm doing is I'm just checking for symmetry, and I'm watching his respirations, which look good. No laboring, no use of accessory muscles, nothing like that. So just his respiratory effort, it looks normal. And I'm also watching for any pulsations or heat. I'm going to palpate the chest wall and the precordium for any thrills, heaves, or pulsations. So I'm going to start with that. Palpate the left chest for the apical pulse, for the apical impulse, the right chest for the apical pulse. And then once again, I'm going to check for tactile for this. So I want you to say 99 for me as you feel my hands move, okay?
99, 99, 99, 99, 99, 99, 99, 99.
Very good. Okay, so I'm going to percuss the chest wall, or I should hear more resonance other than the area over the heart, which should sound more dull. Now we'll also take the heart sounds. I will listen over the aortic area, the pulmonic area, Erb's point, and the tricuspid area, and over the mitral area. Now I have the patient reclined at about a 45-degree angle, and I'm going to check for jugular venous pulsations. If I don't see them, I would apply pressure to the abdomen to see if the JVP rises. It also helps to have the patient turn his head from left to right as I look to the right side. To measure the JV pressure, I would place a ruler at the sternal angle and then a ruler perpendicular to that at the JV pulse. I would note how many centimeters this was above the sternal angle, and I would add 5 centimeters to this number, and this would be the JV pressure, which normal is equal or less than 9 centimeters. In this case, because he is so healthy, it's difficult to see the JV pulse, so we did not measure it. If I did see any pulsations, I may be concerned about right-sided heart failure. Just relax your neck. And I'm checking for any pulsations, which I do not see. As I move forward, I'll go to the abdomen. So I'm going to ask the patient to lie down, inspecting the contour with my pin line. Notice that I turned the lights down as many as I could so that I'll be able to have a better view with my pin line. And I'm just checking for any pulsations or movement, any visible peristalsis. Contour looks normal. Now I will auscultate the 4 quadrants of the abdomen for bowel sounds, and I'll auscultate the arteries, the aorta, the left and right renal, the left and right iliac, and the right and left femoral using the bell of my stethoscope. Now I will percuss for tone. I'm going to percuss over the liver borders on the right, and then I'm going to percuss for splenic dullness on the left. Now I will do light and deep palpation, looking for any splenomegaly, any herniations, or any tenderness. I'm going to start with the right costal margin for the liver border, and then the left costal margin for the spleen, which I should not be able to feel. And then I'm going to palpate for the right and left kidneys, and then midline for any aortic pulsations. Also want to make sure that the abdominal muscles are intact and not separated. Okay, so we're going to start with light palpation. I'm going to push in lightly, okay? And don't tighten up your muscles or anything like that. I'm going to go a little bit deeper. Hand up underneath right here. And a little bit deeper. Very good. Okay, we're going to go to this side. I'll lift up on you a little bit. There you go. Is that uncomfortable? Do you have any tenderness? Okay. First, I'm inspecting the skin, looking at hair distribution and muscle mass, looking at the legs and the feet. Okay, it looks good there. Also felt for temperature, if there's any edema, which I don't see any. Nothing there. Okay. And then I'm also going to check the dorsalis pedis, popliteal pulses, and the posterior tibial pulses in his feet. And just let your legs hang down. Okay. There you go. your knees. As far as the neurological exam, we have completed that previously as the assessment has progressed. And last but not least, I will assess the musculoskeletal, starting with reflexes. So first we're going to do the brachial, then the knee, and then the Achilles tendon. So I want you to go ahead and just put your arms out for me like that. Okay? Very good. Okay, let your legs hang down. Okay. Okay. And then we'll do the Achilles. Okay. Very good. Now we're going to check for muscle strength, so I'd like to see you stand. Okay? And then I want you to walk over there and back. Okay? And then I want you to do a squat for me. Good, and up. Very good. Okay. All right, I'm going to check the curvature of your spine. Okay? So I want you to turn around towards me, and I want you to bend over, and I want you to let your arms hang loose. Okay? So just bend over. We're going to do about a 90-degree angle. Can you go any lower for me? Okay. And I'm just looking at the spine, the cervical, the thoracic, the lumbar. He does have a slight curvature, a little bit of scoliosis there that's noted. Okay. So now I will wash my hands as this concludes my assessment.